So today is June 18, Fast Coder 21's free medical coding YouTube live session number 30 for CPC certification exam. Topic musculoskeletal system coding. So today's first question: what type of joints are considered synovial joints? So now it is 9:16. We will discuss the answer at 9:20. So you can post your answers on the chat box now. So this is one of the important question. So whatever you know, just post in the chat box whether it is right or wrong. Yeah, no worries, Rajlakshmi. Best of luck. So do you want all these links on your email? But everyone can see. So guys, can you see my screen or not? Can you see the question? No need, Rajlakshmi. I think I have your email ID. So I will send to that email ID. So Elena, can you see my screen? DS. Rajlakshmi, can you see my screen now? So Sarika, I think it is problem from your side. So Srinath can see the screen. So try to adjust your settings. Thank you, Alina. But I think you need to adjust your settings, Sonal. My side is proper. Why means Elena can see and Srinath can see properly. Yeah, DS also see can properly. So you need to adjust yourself. I think you can see now. Okay, thank you guys. Thanks for your reply. So go ahead and write your answer in the chat box now. So it is very important question. While if you are working as a surgery coder, it is very important to know about synovial joints. Yeah, no worries, Sarika. So I will wait for you. So Sonal, try to answer this question. So if you don't know, you can use the Google also. No problem. If you see only, you can remember next time. But Sarika can see Sonal. I think you need to adjust your settings. See here, you have one range box. Yeah, thank you, Rajalakshmi. So here you need to keep quality auto 720p. Yeah, thank you, Sarika. Thank you very much. Yeah, try to change the settings. Okay. So we will discuss the answer now. So which types of joints are considered synovial? So basically, whenever we see synovial, we need to think that this question is related to synovial fluid. So what is synovial fluid? Synovial fluid is a fluid which will found in the cavities or synovial joints with its egg white like consistency. So its appearance is like egg like consistency. The principal role of synovial fluid is to reduce friction between the articular cartilage of synovial joints during movement. So the common types of synovial joints here are ball and socket joint, hinge joint and saddle joint. So here our answer is B. Ball and socket joint, hinge joint and saddle joint. So for example, if you are working as a surgery coder, most of the time you will find synovitis and physician will perform synovectomy. So it is like inflammation of synovial fluid and physician will remove the synovial fluid. So which will usually we'll call it as synovectomy. So ectomy means removal, synova means synovial fluid. So here physician will debride the joint and he will remove the synovial fluid and he will place artificial implant there. So usually in arthroscopic procedures, you will find this synovectomy procedure. Yeah. Have you adjusted your settings, Sonal? Yeah, nothing. Just you need to go to the wrench section and you need to change your settings. Okay. So we'll go ahead and try for second question. Yeah, go ahead and try with this second question now. So now it is anyway here you need to, yeah, okay, no problem. Anyway, it's visible for you. So here our answer is a physician applied a cast and also provided all of the subsequent fracture care. Okay. So physician applied the cast and also provided fracture care. The same physician may report the application of the cast separately from the fracture care. So basically, based on CPT guidelines, fracture care is included in the casting is included in the fracture care. So here we no need to code fracture care separately, cast separately. So as casting application is included in the fracture care. So our answer is here B. Our answer is B here. Physician no need to code cast application here along with fracture care, as cast application is included with fracture care. Thank you, Sarika. No, Sarika, it is answer B, false. So you need to remember here that initial cast application is included with fracture care. So physician can't code the cast application during the initial encounter. So here our answer is B, false. So along with fracture care, physician can't code casting application. Try to remember this one. Answer is B here. Yeah, next one, guys. Third question. Now it is 9:29. We discussed the answer at 9:33. So try to find the keywords first, then try to answer this question. So what, Elena, did you get job? So already you told you are working, na? No, initial encounter they will not add. Okay, okay, no worries, Elena. I will not disturb you. So don't worry. So Alina, we have started surgery training, live chat training. So anyone is interested from US, please let us know. So we have 1 more minute. So guys, write the answer in the chat box. If you don't know, also try to write anyone. So during CPC exam also, you no need to skip any answer as there are no negative marking. You need to attempt each and every question. So 9:33 now. So a physician designed and prepared processes for partial lift processes. How should you report the physician professional service for this process? So basically for this processes, our code is 21083. As based on our question, they are asking for physician professional service. So there we need to add 26 modifier. So our answer will become 2108326. So which is B. So we need to code for professional service. So our processes code is 21083 and for professional service we need to add 26 modifier. So our answer is B here. So guys, check fourth one. So now it is 9:34. We will discuss the answer at 9:38. So you have 2 more minutes. So Sonal, try to answer this one as it is a most important section in the musculoskeletal system, which are arthroscopic procedure. So most of the time we will code from shoulder and knee in the arthroscopic procedure section of musculoskeletal system. So we have 1 more minute. After 1 minute, we will discuss our answer. Yeah, thank you, Sarika. So now it is 9:38. We will discuss this question. So the patient presented for medial meniscal tear of left knee. So this is the keyword here for us. Arthroscopy with partial medial meniscectomy. So this is also one keyword here. So you need to remember that in arthroscopic procedures we have meniscal repair as well as excision of meniscus, which is meniscectomy. So here physician has performed arthroscopy with partial medial meniscectomy left knee and arthroscopic picking of the lateral femoral condyle left knee was performed. Code the procedures and codes. So we will check 29880 first. So what is 29880? So basically 29880 for meniscectomy medial and lateral. So here 880 includes medial and lateral meniscus. What is 79? So 79 is abrasion arthroplasty, includes chondroplasty where necessary or multiple drilling or microfracture. So half of the answer is correct here. So we will check 29882. So 29882 is meniscal repair. So but based on our question, physician has performed meniscectomy. So here we have only two options, B and D. So among these two we need to select one. So we will check 29885 now. 29885 is for drilling for osteochondritis dissecans with bone grafting with or without internal fixation. This is not performed. So basically here our answer is B, 29881 for medial meniscal tear meniscectomy and 29879 for drilling of holes. If you see in the code description, multiple drilling or microfracture. See here is the keyword drilling of holes. We need to select 29879. If you check your CPT book, you will find abrasion arthroplasty or multiple drilling or microfracture of the meniscus. And also you need to append 51 modifier as well as laterality modifier here. So here our answer is B, 29881 LT, 29879, 51 LT. So guys, check fifth question now. B is the answer, Sarika. B. B is the answer, not C, not D. Yeah, now it is 9:41. So all of you try for fifth question. Now it is 9:41. We will discuss the answer at 9:45. Yeah, thank you, DS. So 29885 is for 1 second. 29885 is for drilling for osteochondritis dissecans with bone grafting with or without internal fixation. So here you need to have the keyword osteochondritis dissecans. Usually we will call it as OCD. In operative report, you will find it as OCD. So OCD means osteochondritis dissecans. So if the patient has this lesion, physician will perform 29885. But based on our question, patient does not have OCD. So there is no need to code 29885. Our answer is 2988879. Thank you, Sonal. So you guys are having 1 minute. So in order to help others, please click on like button. So if you click on like button, YouTube will send our video to other people. So they will get benefit from this free session. Even it will motivate me to provide like these sessions every week. So if you forgot to click on like button, please click on it now. So now it is 9:45. We will discuss our answer. What is it? First we will check 20551. First we will check the question, then we can find the answer. So patient complains of chronic/acute arm and shoulder pain following bilateral carpal tunnel surgery. Okay. Patient is followed by pain management for over a year. Physician finally diagnoses patient with reflex dystrophy syndrome. So we will call it as RSD. Physician performs 6 trigger point injections into 4 muscle groups. So here 6 trigger point injection into 4 muscle groups is the keyword. So our total question answer depends on this one only. So this is the most important keyword. So we will check first 20551. So injection, single tendon origin or insertion. So basically it is 20551 is related to tendons. So we need to check for muscles as trigger point injection into 4 muscle groups. So we will skip 20551. So we will check 20552. Here injection singular multiple trigger points 1 or 2 muscles. So basically based on our question we have 4 muscles. So but 20552 is having only 1 or 2 muscles. So 20552 also wrong. So we will check 20553 now. Singular multiple trigger points 3 or more muscles. So we need to select answer D, which is 20553. So why B is wrong? As our code description is having already 3 or more muscles. So because of that reason, we can't code B, which is 20553 times 6. As our code description is having more 3 or more muscles, we need to choose D is the correct answer. So here our answer is D. So anyway, most of the guys wrote correct answer only. Yeah, thank you, Sonal. So we will check second question now. Sorry, sixth question. Yeah, go ahead and try for this. So now it is 9:48. So we will discuss the answer at 9:52. Yeah, you have 3 more minutes. Yeah, thank you, DS. We will check that answer. Thank you, Sonal. So we have 2 more minutes. So you have 1 more minute. So now time over. So now we will check the question and find the answer. Dr. Roy completed a deep transfer. So here a deep transfer is the one keyword of the anterior tibial and flexor digitorum tendon. So here we need to understand that physician has performed deep transfer of two tendons. So anterior tibial and flexor digitorum. Which code should be used to report this procedure? So first we will check 27658. So what is 27658? Repair, revision under reconstruction procedures on the leg and ankle joint. So which is wrong here? So basically physician has performed the transfer of tendon, not repair. or revision or reconstruction. So we can eliminate 27658. So we will check 27690 now. So basically 27690 is for single tendon, transfer or transplant of single tendon. So but based on our question, physician has performed procedure on two tendons. So we can eliminate B also. So we can check C now. So what is C? 27691. So which is correct? As based on our question keyword, here physician has performed deep transfer and we need to code for one more additional tendon here. So here we need to add-on code plus 27692. So here our answer is C. So why D is wrong? Here physician has this question is having 27692 times 2. So here physician has performed procedure on two tendons only. If the physician tells three tendons, we can quote 27692 times 2. So basically option D is for three tendons as 27691 for first tendon and 27692 times 2 is for remaining two tendons. So total three tendons. But here our question is having only two tendons. So our answer is C here. 27691 and 27692. Anyway, most of the people wrote correct. So try for the seventh question, guys. So try to answer seventh question. First, try to find the keywords, then choose your correct answer. So we will discuss answer at 9:58. Yeah, yeah, okay. Sorry, DS. I will make it up. So can you see now? Yeah, thank you, Sarika. So now we will check the answer. So as soon as you see, just to we need to eliminate the answer here. We will check 20600. So first we will check the question. Which codes would you report for an aspiration and injection of ganglion cyst to the bone of the left great toe? So basically here physician has performed aspiration and injection of ganglion cyst to the bone of the left great toe. So not to the joint. So just bone of the great toe physician has performed aspiration and injection. So if we check 20600 arthrocentesis, aspiration and or injection, small jointer bursa without ultrasound guidance. So basically left great toe is a not a joint. Physician is clearly mentioned here bone of the left great toe. So because of that reason we can eliminate A and D. So as physician is not performing aspiration and injection of joint. Basically arthrocentesis means aspiration of the fluid. Synthesis means aspiration of the fluid. Arthro means joint. So 20600 denotes arthrosynthesis of joints. So here physician did not perform aspiration into the joint. So we will eliminate A and D. So we are left with only two options. We will check 20612. So what is first one? Aspiration and or injection of ganglion cyst. Any location 20612. We will check 615 aspiration injection for treatment of bone cyst. We will check now. So based on our question, our answer here is 20612, which is B. As 615 is for bone cyst, 612 is for ganglion cyst. So based on our question, physician has performed procedure to the ganglion cyst. So our answer is B here. So anyway, most of the people wrote correct answer. So DS, this is answer B, not D. Sorry, not C. So basically C is for bone cyst, not for ganglion cyst. But based on our question, we have ganglion cyst, so we need to choose B, 20612. So okay, DS, no problem. So now we can check question number 8. So now it is 10:1. We will discuss the answer at 10:5. Yeah, thank you, Pooja. Good evening. Thank you, Sonal. We will check the answer soon. So most of the people wrote correct answer and we got our answer. So we will check the answer now. So here, eighth question, baby is a 36-year-old patient who underwent a subcutaneous excision. So here it is the keyword subcutaneous excision. So means up to subcutaneous level, physician has made the incision and excised the lesion. So and of an 8 centimeter spongy tumor. So here, sorry guys, yeah. So here 8 centimeter is the one keyword for us. And location is also one keyword. So total we have three keywords here. So using these three keywords, we need to find the proper answer. So we will check 2 to 900 first. So what is 2 to 900? Excision tumor soft tissue of abdominal wall subfacial less than 5 centimeters. But based on our question, physician has performed soft tissue excision until subcutaneous tissue. So 2 to 900 is wrong. We will check 2 to 902. So excision tumor soft tissue of abdominal wall subcutaneous less than 3 centimeters. So but based on our question, physician has performed 8 centimeters incision. So 2290T is wrong as we will use 22902 for less than 3 centimeters. So as ours is 8 centimeters, we can eliminate 22902. So we will check 22903. Yeah, 2290 is correct answer as it is excision tumor soft tissue of abdominal wall subcutaneous 3 centimeters or greater as our excision tumor size is 8 centimeters. We can choose 22903 is the correct answer. Anyway, we'll check 22905 also. Basically, 22905 is for radical resection of tumor like sarcomas. So, with this explanation, our answer is B 22903. So, go ahead and check this answer, guys. Yeah, correct, Sarika. You are correct. So now it is 10:07. We will discuss the answer at 9 question answer at 10:10. Try to answer ninth question now. We have 2 more minutes. Thank you, Pooja. Just we need to choose the keyword first, then we need to code. That's enough. So choosing the keyword is very important, whether it is CPC or surgery coding. Thank you, Sonal. So we have 1 more minute. So in CPC exam, reading the code description is very important. So we can't upcode or downcode. Just you need to have good comparison skill between our question as well as the code description. So if you compare well, you can do properly. So now it is 10:10. We will discuss our answer. So a patient presents for steroid injection into the bilateral SI joint under fluoroscopic guidance. How should you report this? So we'll make it as keyword here. So what is this? Steroid injection into the bilateral SI joint under fluoroscopic guidance. So we will check 27096. So injection procedure for sacroiliac joint, anesthetic steroid with imaging guidance, including arthroscopy when performed. So basically, based on our code description, fluoroscopy is included in 27096. So directly we can eliminate A and C as fluoroscopy is included in the code description. And we have options B and D. So if you check the guidelines under 27096, code 27096 is a unilateral procedure. For bilateral procedure, use modifier 50. Based on our options, we have B is the correct answer. As physician has performed bilateral SI joint injection under fluoroscopic guidance. So here our answer is B. As based on CPT code description and guideline, we need to add 50 modifier for bilateral procedure. So anyway, most of the people wrote correct. Congrats, guys. So Sonal, you need to remember fluoroscopy is included with code description of 27096. So we no need to code fluoroscopy separately. And Pooja, 27096 is for unilateral, but based on our question, we have bilateral procedure. Okay, Sonal, I will tell you. Check under 27096. Open 27096. And under 27096, you have one guideline within the brackets. You have multiple guidelines there. So last guideline is related to this bilateral procedure. So but based on my book, it is 289, but I have splitted this CPT. So page number is wrong, but we can check under 27096. That's better. So what version you are using now? I am using 2022 version CPT book. So if you have 2022 version, you can find it. Yeah, thank you, Sarika. So now we will check question number 10. Now time is 10:13. We will discuss the answer at 10:16. Yeah, you can find it. No worries. So in CPC exam also like that only. As soon as you see choose one answer, you need to find any guidelines related to that code so that you can code properly. So Sonal, now try for this one, 10th question answer. So now it time over. I think we can discuss the question. Yeah, thank you, Sonal. So a patient present for injection of steroid into the right SI joint as well as trigger points in the trapezius, iliopsoas and quadriceps muscles. How will you report this one? So what is 20553? 20553 is for single or multiple trigger points, 3 or more muscles. Yeah, for trigger points, 20553 is correct answer. So now we will check answer for injection of steroid into the right SI joint. We will check 27096 now. Yeah, here injection procedure for sacroiliac joint anesthetic steroid with imaging guidance including fluoroscopy or CT when and arthrography performed. So here our answer is D. 20 sorry not D. What is this? 20553 and 27096. C is the answer. We can make it as D. As it is unilateral, we need to append the modifier here, right modifier. So D is the correct answer here. We need to code for two procedures. One is trigger point and next one is for injection. And DS, B is for 552 and 553 is for trigger points. So B is wrong. A is also wrong as we need to code for two procedures. Injection of steroid into right SA joint and also we need to code for trigger points. Yeah, D is the correct answer. As based on guidelines, we need to add laterality modifier to 27096. Yeah. So now try to understand that we need to code two procedures, not one. Go ahead. Now it is 11th question. So now it is 10:19. We will discuss the answer at 10:22. Yeah, no worries, Sonal. Just to try to read the question properly. So we need to identify how many procedures are performed by the physician. So now try for question number 11. So try to find the keywords first, then answer and check the description properly. Okay, we got few answers here. So we will discuss this one. So a 45-year-old female undergoes bilateral SA joint injection. Okay, with ultrasound guidance. So we need to check this one. So first directly we will go to 20552. So what is 20552? Injection singular, multiple trigger points, one or two muscles. So basically here physician has performed steroid injection into SA joint, not trigger point. So 20552 series is wrong. So A and B are wrong here. So we need to choose among C and D. So we will check 27096. So if you check 27096, injection procedure for sacroiliac joint anesthetic steroid with image guidance, fluoroscopy or CT including arthroscopy when performed. And also if you see parenthetical note here, 270 is to be used only with CT or fluoroscopic imaging confirmation of intra-articular needle positioning. So in our question, physician has used ultrasonic guidance, so we can't quote 27096 here. So next guideline is if CT or fluoroscopy imaging is not performed, use 20552. So here we need to use 20552, and also physician has performed bilateral SI joint injection. So we need to choose B, 20552 and 50 modifier based on the guideline under 27096. So 11th question answer is B. Based on guidelines, if physician use ultrasound guidance other than fluoroscopy or CT, we need to use 20552 and we need to give laterality modifier. No Puja, you can check under the 20796. If you open 27096, we have one parenthetical guideline stating that if CT or fluoroscopy imaging is not performed, use 20552. So we need to use this one. If you check under 27056 you can find this. So based on our guideline, answer is B, 20552 and 50 modifier. So we will check 12th question. So now it is 10:26. We will discuss the answer at 10:30. So 12th question answer please. SDS based on parenthetical note under 27906, sorry 27096. If CT or fluoroscopy imaging is not performed, we need to use 20552. Can you see that one in your CPT book? But even I too have a doubt. So I will check. So next week we can discuss this one. Might be CPT book is wrong. So if you have CPT book, check under 27096. You will find if CT or fluoroscopy imaging is not performed, use 20552. But based on our question, physician has performed ultrasound guidance. So we need to use 20552 as we can't use 27096, which we will use for fluoroscopy or CT. So check under 27096, you can get clear idea. So now try for question number 12 now. So you have 2 more minutes. No, Sarika. 11th question answer is B based on CPT book parenthetical note guideline. B is the correct answer 2055 to 50. So now you can try for 12th question answer. So we need to follow the CPT book. Yeah, 12th question answer please. So now we will check 12th question. What is this? Posterior placement of pedicle screws and rods at L2 S1 is reported using which instrumentation code? So we will check first 22840 posterior non-segmental instrumentation. So here physician has mentioned pedicle screws and rods at L2 S1 is reported using which instrumentation code. So we will check 22842 posterior segmental instrumentation. Here pedicle screws. Yeah, we will check 22843 now. 7 to 12 vertebral segment and 85. 85 is for anterior instrumentation. So based on our question, physician has performed posterior instrumentation. So we will eliminate D. Option D, we need to check 404243. So basically 840 is for, based on our question, our keyword is pedicle screw here. So if you check 22840, pedicle screw is not mentioned here. Here only pedicle fixation across one interspace. But we have L2 to L3, L3 to L4, L4 to L5, L5 to S1. So we have four interspaces. So 840 is for only one interspace. So 840 is wrong. So we will check 22842. So 840 is for posterior segmental instrumentation, 3 to 6 vertebral segments. So here we have 4 vertebral segments. 22842 is the correct answer. So basically 843 is for 7 to 12 vertebral segment, but based on our question, physician has performed instrumentation on 4 vertebral segment. So our answer is 22842. So which is B. Yeah. Thank you DS and Sonal. So thanks for your answer. So now check last question of the day. So now it is 10:33. We will discuss the answer at 10:37. So nothing, just you need to find the keyword and you need to compare your question with code description. That's enough. Just check the approach while coding. So now it is 10:34. You have 2 more minutes to answer. Thank you, Pooja. We will check the answer soon. Yeah, thank you, DS. We will check soon. We have 1 more minute. Okay. Can you see now? Can you see now? Okay, okay, cool. So now time over. We will check our options now. A patient suffered a fracture of the femoral head. So patient has a fracture of femoral head. He had an open treatment of the femoral head with a replacement using Medican alloy femoral head and methyl methacrylate cement. How would you report this procedure? So here we need to find the keywords first. Our first keyword is fracture of the femoral head. Next is it is a open treatment. So next is physician has replaced using Medican alloy femoral head and methyl methacrylate cement. So these will come under prosthesis. So we have femoral head fracture, open treatment, and we have prosthesis. So we will check our options now. So basically we will check 27236 first. Yeah, 36 is the correct answer. Open treatment of femoral fracture, proximal head, neck, internal fixation or prosthetic replacement. So here physician has replaced femoral head with prosthetic implant like using the Medican alloy and methyl methacrylate cement. We will check 27235 now. So basically 35 is percutaneous procedure. So you need to remember that in musculoskeletal system we have three types of approaches. One is open, second one is closed, third one is percutaneous. So 35 is for percutaneous procedure but ours is open procedure. 38 is for closed procedure but ours is open procedure. So because of that reason our answer is B here 27235. So basically 27275 is for manipulation of pelvis and hip joint. So D is the wrong answer. So C is wrong. Why? It is a closed procedure. So A is wrong. Why? 27236. It is a percutaneous procedure. Sorry, 1 second. Yeah, 35 is wrong. Why? It is a percutaneous procedure. Our answer is A 27236. Yes, physician has performed open treatment of femoral fracture here. Yeah, most of the people wrote correct answer. Yeah, correct only. So thank you guys. We will conclude this session here. I will wait for 3 more minutes. If you have any doubts, you can ask here. I will try to rectify. And also please remember to click on like button. So it will motivate me to provide more useful videos for you guys. So nothing secret here. Just we need to compare the our question with the code description. That's enough. So I'll conclude this session at 10:43. Thank you, Sonal. So next week onwards, we will have continuous sessions. I will wait for 2 more minutes here in order to help you. So we have started live chat training for surgery coders. So any one of your friends wants to learn live surgery chat coding, please let us know. Yeah, no worries, DS. Thanks for coming. So and encourage your friends to subscribe to our channel and also attend these sessions. These are very important in order to successful in medical coding. So thank you guys. I am stopping this session here. Thanks for visiting Fast Coder 21.